So following on from everybody else's talks, I'm going to be talking about the benefits and burdens based on some research that our research team has been doing, a recent focus group study on e-health ethics and chronic illness. So our study was on e-health ethics and chronic illness, and we did focus groups with patients and healthcare providers, and the findings I'm going to talk about today are from the patient groups. So we had 4 focus groups with 18 participants, all of whom had arthritis and at least one other long-term condition. Their age range was from 30s to 70s, and there was 16 women and 2 men who took part. And we asked them in the focus groups, what types of e-health, online resources, devices, technologies did they use for health purposes? And how did that impact their communications with their healthcare professionals and their healthcare? And what for them were the pitfalls and the benefits of using e-health? We recorded the focus groups, and then we had them transcribed, and we had the paper transcripts. We looked at them carefully, in detail. We compared them to see what people were saying, and we noticed that people were talking a lot about similar sorts of things, not surprisingly, reflecting much of what we've been talking about already today from the patient's perspective. They were talking about burdens, and in particular, how the hard work involved in effectively using e-health and the struggle and the frustration that that often caused. Also, the benefits, though, were really potentially significant, and how empowering it was when they were able to work with their healthcare professionals with, for instance, online information. That made an enormous difference, having supportive healthcare professionals. To give you a clearer picture of those experiences and what people talked about in those focus groups, we organised the patients' voices into monologues. And we have 2 monologues, one burdens called Clogging the Brain, and one presenting the benefits, what people said about that, and feeling empowered. And so to talk through and to perform those monologues, Marilyn is here, and she is going to give you an insight into what exactly the patients said using their voices from the focus groups. So Marilyn, thank you.
This whole internet and all that stuff, it's happening and it's changing very fast. Yeah, I have a hard time with technology, and I'm being dragged kicking and screaming into this new world. And I get frustrated very quickly. My patience level has gone down, and then I'm like, I just forget it. You come to a point where you have so much information, and then you have a little roadblock. That's when I do the ostrich approach. Often when you go to Google, they give you a list of different sites or people, and then I'll go in and investigate those, and that takes you into another whole dimension. Sometimes you just get lost, and I don't know where I am. Even when I'm looking for just one drug, I've gone on my computer for nearly an hour. I go in and read. It goes from one page to the next, and then I can't get back to check it. It's a struggle, and I can't physically or mentally handle it. I feel like I'm kind of a baby. I have my daughter at home, and I'm like, okay, how do I do this? How do I do that? Where do I find this? So I get a lot of help from her. And then I worry about it being reliable information. There's so much garbage out there. People are saying different things. There's people trying to sell you snake oil. It's confusing. It can be challenging when you're getting conflicting information. I'm a little overwhelmed actually with it all, and trying to decipher what I can trust. The other thing, I don't go on the internet if I'm depressed. I think whenever we read about something, you think, well, do I have that too? I'm having trouble with my eyes, and that concerns me. Before I would have thought, oh, it's just sore eyes. And now I'm thinking, oh, Sjogren's. So it can bring fear. I've got an appointment to have my eyes checked, but it isn't for a little while. And in the meantime, I'm thinking, I'm going blind. Ah! You know, it's scary. So I have a lot of fear, and that makes me go back to search more. It's horrible, but then it's like an obsession to me. I really don't want to know anymore, but I need to know. So I'm drawn back to these sort of dark places because it could be my future. But it does make me determined to get the eye test. It's hard work, but I am learning. The reliability is important. So if information, if it's backed by some university that's very, very preferable, and whether it's a top university, I look for the universities or hospitals that do the research. I find that out if I can. I go on their site and look there. I look for the common thread in what people have found. If the same thing comes up again and again, where there's smoke, there's fire. There is probably more legitimacy to it. Also, I look at the reviews and the comments of what people have said about particular information. It's a lot of work to get to the details, but if you gather all the different information from different places, it's a lot easier to make decisions about what's best for you. Benefits. People take more responsibility for their health. It's my body, my disease. It's happening to me. We want information so that we can make our own decisions. I have to keep myself as informed as I can. That philosophy is being promoted, whereas 10, 20 years ago, it wasn't. Like when my rheumatologist suggested taking methotrexate, I found out on the internet that if you take it in pill form, it goes through your liver twice, whereas if you take it by injection, it's only once. The doctor hadn't told me that, but through looking at websites, I made a decision that I would rather inject it than take it in pill form, so I'm more direct now. In the old days, I never questioned a doctor. I just listened. You went in, you were told what was wrong with you, and you went out with a piece of paper that would cure you. They gave you prednisone, you took prednisone. Now, I don't think so. I'm also realizing now that doctors really can't know everything. They're not miracle makers from some higher power. They're human too. There's no way they can keep up with all the information. Actually, it makes me trust them when they say, I don't know. Let's look it up. My rheumatologist is like that. I have taken information in from the internet and she has said, oh, well, tell me a little more about that. I think we have a responsibility to come to them with that information. I'll take my doctor's advice for certain things, but I have to trust myself as well. It's not that I don't trust my doctor. I do completely trust her, but I also take what I see online and I take that to my doctor. I use the internet to look into different medications and I prepare for a good discussion. My rheumatologist and myself work really close. Right now, I'm concerned about interaction with the other drugs I take for the inflammatory arthritis. I went to look it up on the internet because I was prescribed a corticosteroid when I'm taking other immunosuppressant drugs. I have the prescription for it, but I haven't bought the medication yet. So I'm waiting to talk to my rheumatologist about it, to talk about what would interact with each other or nullify each other when different meds are taken. That's why I have all my doctors communicating. That's why my file is about this thick and comes in a wheelbarrow. Empowered, right. I'm part of a team. You need to trust your doctor to have the confidence to take information that you find online to them. It doesn't foster great relationships if there isn't that thread of trust binding you together. And doctors need to trust patients too. So I need to be prepared when I go into the office so I don't bombard her with stuff. I write my list and then I rewrite it with the most important at the top. I prioritize what I take in and what I ask to prepare for a good discussion. I feel more educated and more comfortable to discuss things with my doctor with the internet information. It makes me feel like I have some control. To work with my doctor and have a respectful relationship with all of my healthcare team, that's really important to me.
Thanks very much, Marilyn. And I think Marilyn did participants proud. You can applaud her in a just a tick. You know, when Michael asked the question earlier, what's ethics got to do with it? And if we listen to the voices of patients and healthcare professionals too, we can hear ethics threaded through the talk and the experiences, talking about the burdens and the benefits and the potential benefits. So for me, I think e-health and ethical care is really the same as any type of provision of health and ethical care. We want to reduce the burdens, and first of all, to reduce burdens, we need to recognise what those burdens are, recognise that e-health is often a lot of patient work and struggle, and the patient, what are the patient needs, and patient needs support, and what supports are those. And in order to optimise benefits, which again is ethical care, we need to recognise the importance of relationships. Everybody's been talking about relationships, trust today. Our focus group participants did, the patients did, Professor McDonald did. So that mutual trust and respect going both ways between patients and healthcare professionals seems crucial in order to build this idea of patients and clinicians engaging with each other to form partnerships of genuine collaboration. And e-health, it seems, potentially can help and support that sort of move towards that new model of care.